we'll just give it that term. At that point, the corpus luteum is only good for about 14 days. And then it disintegrates. When the corpus luteum disintegrates, progesterone levels dramatically drop, and that stimulates the shedding of the uterus. Now, if someone were to get pregnant, the embryo itself will take over the production of progesterone. And that will prevent any uterine lining from occurring, and that will actually produce progesterone for about 7 weeks after to keep progesterone levels elevated. And one of the things, you know, I have a lot of patients ask me about is something you may have heard of called basal body temperature, or BBT, or temperature charting. One of the things that we see is that progesterone is really key for keeping the oral temperature elevated. So women will find that the first half of the cycle, your temperature should, you know, maybe be in the low 98s, and then from ovulation onward, we should actually have a rise in the temperature. And that temperature should maintain fairly high levels right until the period occurs, and that is due to progesterone.
Nice. So what happens to those women, you know, whose the last 14 days get either longer or too short? So they don't end up being the 14 days, but they end up being, say, 19 days or 20 days before the next period, or some women shorter.
So that is why I say that the luteal phase is where I put a lot of my focus on, because that's where we have dysfunction, luteal phase deficits. And there's a couple different ways that that can happen. We can have shortened luteal phase, or we can have an extended luteal phase. Let's talk really quick about the extended luteal phase, because actually the extended luteal phase, or a period that goes too long, longer than 28 days or longer than 32 days, and then becomes abnormal, that actually indicates that ovulation did not occur on day 14. If ovulation occurs on day 14, and someone does not get pregnant, 14 days later, we should have a period, because there's nothing else to keep that lining going. The corpus luteum naturally disintegrates, progesterone levels drop, and we have to start shedding. So if we don't have a period, say by day 32, and then we have a period maybe day 40, so we have a long cycle, what I know is that ovulation did not occur when it was supposed to that month, and more likely it probably didn't occur at all. We might have just had a skipped ovulatory month. Now when that starts happening consistently, that's when I start looking into different types of diagnoses. There's certain ones, PCOS being the most common one, that will cause that on a regular basis. Certainly there are some times where ovulation just doesn't occur. I'll have, you know, someone come in and they'll say, you know, doctor, I've had normal periods my whole life, but I just had a 40-day period. That's never happened to me before, and I'm not pregnant. I took 5 pregnancy tests, I swear. I'm not pregnant. And I'll you know, trace things back, and often I'll find that it was around finals week, or is a really stressful time in their life, and I'll say, you know what, you just didn't ovulate. The stress overcame your brain's ability to release the hormones you needed in order to ovulate this cycle. You know, and I'll say, let's do a few things to help work with your stress. Maybe we'll do a little bit of acupuncture, but I would assume that if we can manage the stress, your cycles will come back like they were previously, and often that is the case. So there's those rare instances, and then there's the times when it's consistently 40 days, 52 days. That's when we actually have a dysfunction on our hands that I will then very much investigate. PCOS, or polycystic ovarian syndrome, is one of the ones at the top of my list for very skipping periods or long periods without pregnancy. And I think we'll talk a little bit more about that in a moment. Let's talk about the early luteal phase deficits. That's when we have periods that are lasting maybe 22 days or 24 days. So they're shorter than what they should be. So we're having bleeding more often. That also leads to some issues like more chances of anemia if you're having more bleeding more regular than you're supposed to be. What that tends to mean is that we often have a progesterone issue. usually if we had ovulation, our progesterone levels should be high enough to allow us enough time to prepare the uterus and prepare an egg. When we start having consistent periods that are much shorter, that luteal phase deficit is often due to progesterone deficiency. So you're not producing enough progesterone. When I start seeing this, it's generally in women who are maybe in their mid-30s or heading into perimenopause. That's the most common thing we'll start to see, is that the periods start shortening. And it's because progesterone in this day and age, and I'll get into this a little more, progesterone is the most sensitive, and it will have a deficiency first.
Right.
Now, what we know with that is that we are much less likely to have estrogen deficiency problems in the Western world. We are just very prone to progesterone issues.
Right.
There's a lot of reasons
Right.
to the estrogen problem.
Okay.
And you know, we do have an estrogen problem in this country and in the Western
Yes.
world. And what we have is we generally have an excess of estrogen. And I see that, I'd say 9 times out of 10 in women of reproductive age who are walking into my clinic with various complaints. It is almost always some sort of estrogen dominance or estrogen excess or relative estrogen imbalance issue.
Well, I'll love to talk more about this in our next show. We'll continue on with the hormone balancing naturally. And I wanted to bring this point about the longer and shorter periods because in Chinese medicine, it's extremely important that you have your period on time every month. And I tend to hear that women will tell me things like, you know, oh, my hormones, you know, my cycles have been irregular all my life. You know, it's as if that's normal and it's not a huge deal. So thank you so much for joining us today. And I hope this has been very helpful for the viewers. This is Dr. Eliza Kim, and you're watching Everyday Wellness. Aloha.
That's so